Hi everyone, welcome back to my channel. This is Dr. Nakubiana Mufaya Siameka, or you can just call me Dr. Mufaya. So I've decided to just film the two parts of the diabetes series. So I'll make two videos. One will be about the treatment and the other will be about the complications. So I'm post-call, I'm at work, I'm just about to go home and I'm waiting for somebody to leave my back. Yeah, they have blocked me, so I can't go anywhere. Yeah, so oh look, they're leaving now. Okay. Anyways, we'll continue with the video. As I was saying, I'll talk about the two parts of the video, the last two parts before the series is over. Yeah, I think it's been a while since I recorded and I just want to do it now before I go home and see my baby who is waiting for me. Okay, let me just get into it. Yeah, so treatment of diabetes. When you're found to have diabetes and it's your first time being diagnosed with diabetes, if it's type 1, you'll be given insulin. You'll be started on insulin because it's insulin dependent. And if it's type 2, you will be told to try to regulate your blood sugar using diet and exercise or lifestyle modifications. And if that doesn't work, then that's when you'll be started on medication. When it comes to diet, you have to know that it's not about not eating certain types of food. It's about how much food of each type, whether it's protein, fat, carbohydrates, how much of each type of food are you taking? So generally, you're supposed to have at least about 40 to 60% of carbs and about 30 to 20% of protein and about 5 or so percent of fat in your diet. So your carbohydrates are not only shima and potatoes and rice. Carbohydrates can also be taken from vegetables. If you are in Zambia or in any southern African country or even Africa in general, you know that we eat a lot of shima, which is pap, sadza, gari. Yeah. So if you are having that, you could have it with more veg. You could have a small piece of that, let's say half a lump or even just 1 lump, and a lot of vegetables with some protein, and yeah, you're good to go. That's a complete meal. So you just need to know how to plan out your diet. If you are having trouble planning out your diet, you can always ask your dietitians at the hospital to help you. But yeah, that's how it goes. So you could plan your breakfast, your lunch, your supper. It's best if you can plan everything in advance so you don't have to stress so much about food, because I know how much stressful it is to have to think about what am I gonna eat. It's stressful. So if you are able to plan out your diet for the whole week and maybe buy groceries for that week, so that you don't have to stress. In the morning we wake up, you don't have to stress so much about what to eat and what not. So get a dietitian, see a dietitian at your local clinic and ask them to help you. They'll be able to help. And if you would still want me to help you with planning out your diet, I can still be able to help you. You can reach out to me on Facebook or Instagram, or you can send me an email. I'll leave my email in the description box, so you can send me an email if you would want me to help. Yeah, so that's about diet. The other thing is lifestyle modification. When you talk about lifestyle modification, we are talking about exercising. If you're a smoker, stop smoking. Alcohol intake, stop taking alcohol. And one other thing about that is that you need to reduce on how much salt you are taking, because salt also increases your risk. Too much salt, yeah, increases your risk of having high blood pressure, cardiac conditions, and other complications that come with diabetes. So reduce on how much salt you're taking in your food. So do not put extra salt, and reduce how much salt you're putting in your food, and how much cooking oil you're using in your food, and what type of oil you're using in your food. It's best to use vegetable oil. So that's about lifestyle modifications and diet. The other thing is, if your blood sugar does not go down with these remedies, then you will be started on medication by your doctor. And there are various medications that are given. So there are various medications that are given by your doctor, and the doctor will decide what works for you and what doesn't. Over time, they might decide to increase the dosage of how much medication you're taking if your blood sugar is not getting controlled. And your doctors will also order you to do a test known as HbA1c. HbA1c is a measure of how your blood sugar is being controlled in the past 3 months, and this helps to know where you're at in terms of treatment. So if you've never done HbA1c, you can ask your doctor about it, so that they can be able to know how your blood sugars are being controlled. Yeah, if you have any questions and want to know more, you could ask in the comment section, and I'll be glad to explain. For now, that's it about treatment, and I do hope the videos have been helpful. Look out for the next video. I'll be talking about complications of diabetes. For now, it's bye. Please do subscribe to my channel and share with others. I'll see you in my next video.